Welcome to our all candidates meeting on the future of health and social services in Cambridge. My name is Tara Kleinstuber from the YWCA Cambridge, and I'm joined as moderator by Dr. Sharon Ball of the Cambridge and North Dumfries, Ontario Health Team. First, we would like to acknowledge that this event is being hosted on the lands within the Haldeman Treaty of 1784, a formal agreement acknowledging 6 miles on either side of the Grand River as treaty territory belonging to 6 nations of the Grand River. This is the traditional territories of the neutral Anishinaabe and Haudenosaunee peoples, and we honor their stewardship, past, present, and future. The Ontario election is being held on June 2nd, and we hope that this session will help you make your decision about who should represent our community. This event is being hosted by the Cambridge and North Dumfries. This event is being hosted by the Cambridge and North Dumfries Ontario Health Team, Family Counselling Centre of Cambridge and North Dumfries, YWCA Cambridge, the Cambridge Shelter Corporation, and the Cambridge Foodbank. We are thankful for all of the candidates who have committed their time to this event and for putting their names forward to represent our communities. Our candidates joining us this evening are from the Kitchener South Hespeler riding. We have from the Ontario Liberal Party, Ismail Mohamed. We have from the New Democratic Party, Joanne Weston. And we have from the Green Party of Ontario, David Weber. All candidates running in these ridings were invited to participate, with absent candidates citing other commitments or not responding to invitations. The organizers of this event felt it was essential to have conversations around health and social services in our community. These past few years of the COVID-19 pandemic has highlighted many gaps and inequities in our community and has put significant stress on the programs and supports community members rely on. We hope that this session will shine a light on some of these issues and present the plans candidates will be bringing into this election. We will be asking questions about the healthcare system, mental health and addictions, childcare, poverty, and social assistance, housing and homelessness, youth issues, and more. While we have prepared a set of questions, we are also inviting questions from the audience. If you have a question you would like candidates to answer, please enter it into the chat, and you may hear your question addressed to the candidates. Now, we want to get right into the questions, but first, let me go over the rules. Questions will be presented by the moderators, and candidates will be asked to respond beginning in predetermined order and then rotating who answers first. Candidates will have a maximum of 1 minute to respond to the question. A timer will be set up on the screen so that candidates can see how much time they have left. If a candidate is not finished and continues past their allotted time, their microphone will be muted so that the next candidate can answer. If a candidate mentions another candidate or party by name, the moderator will give the candidate named 30 seconds for a rebuttal, and after all candidates have answered the question. The candidates were given the list of questions yesterday and have had time to prepare. And we expect a rigorous debate, but also expect respectful communications. So without further ado, let's get into the questions. So question 1, we will start off with our first question as please introducing yourself and why you are running to be the member of provincial parliament in this riding. So we're going to start with the Ontario Liberal Party, and then move to the New Democratic Party, and then finally the Green Party of Ontario.
Thank you very much, Tara. My name is Ismail Mohamed. Good evening, everyone, first of all, and my name is Ismail Mohamed, and I'm proud to be your Liberal candidate in Kitchener South Hespeler. Thank you for the opportunity to have a conversation today. I'm a father, a husband, and a community leader. I'm ready to serve you as your member of provincial parliament and provide real leadership for Kitchener South Hespeler. I believe that we can work together to find sustainable solutions that will support and reflect our diverse community. The Ontario Liberal Party has put forward an ambitious platform that will help address Ontario's biggest issues and support those who need it most. We're committed to growing our economy while protecting our environment. We will put seniors at the center of public health initiatives and make sure that all Ontarians have proper access to healthcare. And we will reinvest in our education system after Doug Ford and his Conservatives have defunded it for the past 4 years. Kitchener South Hespeler is an incredible place to call home. It's where I have chosen to raise my family after immigrating to Canada over 30 years ago, which I moved from Ottawa. After 4 years of poor leadership, our community deserves better, and I believe I can deliver real, honest representation for our constituents. Thank you.
Thank you. Good evening, everyone. Thank you, Tara, Dr. Ball, and to your team for organizing this forum, to all the organizations for the work you do in the community, and for submitting the questions, and to everyone that's tuning in this evening. Thank you for giving your time to hear our platforms this evening. My name is Joanne Weston, and I'm running for the Ontario NDP in Kitchener South Hespeler. I've raised my family in both Hespeler and Kitchener for the past 25 years. This is my first time running for provincial politics, and I'm taking this step because I care about our community and the people in it. And for so many people, life is getting more difficult, and we need to address some long-term issues that have been neglected for far too long. The pandemic has highlighted the cracks in the different services in Ontario, from education to healthcare to essential social services, and we need to get in and fix all of those items. As a trustee with the Public School Board, I've seen firsthand how parents and children in our community have struggled, especially in the past 2 years, but even before that, with cuts to education and supports in the community. And in the community, people tell me they're having a hard time making ends meet and are concerned about the cost of housing for themselves, for their kids, and for their aging parents. I'm running with the NDP because it's the party that puts people at the front and center of all of their policies. They want to make life better. I want to make life better, more affordable, and help people get ahead. Thank you.
Hi, I'm David Weber. I'm the Kitchener South Hespeler candidate with the Green Party. I've run a few times before. I first ran in 2014 and 2018 on the provincial level. I got interested in representing the community in this way with my involvement with Waterloo Regional Police. I was still working when I first started to run. I'm now since retired with 30 years, having served the community in law enforcement. In that career, I certainly saw the community up close and personal, dealt with children, dealt with everyone from every age up to the elderly. I've seen what their needs are and where we've failed them. I'm a firm believer that we can do much better in having a more caring society, more interconnected, and we can live in harmony with our planet. We can design our systems that are sustainable so that we can survive long term, and we can at the same time thrive. Now, just for a matter of record, we ordinarily don't have questions given to us in advance, and I'm used to that. But in this particular case, my understanding is questions were given, I didn't see them. So since it's only a minute to respond when we are given the questions, I'm hoping I can stay within that minute because everything's going to be new for me for what's expected to be given out. So hopefully that goes well. But I am glad to be here and to share some information and to learn from others. I look forward to hearing the questions from the attendees, and hopefully we have an enjoyable evening where we can all learn something. Thank you.
Thank you very much, everybody. So here we are at question 2. As COVID-19 enters the endemic phase, the health system looks for guidance from the next government. What do you see as priority areas for investment in healthcare in Cambridge and North Dumfries? NDP, we'll start with you.
Thank you. So I think we're going to address some of these that I'm going to speak to later in the question, but mental health and addictions support is urgently needed, not just in Cambridge, but throughout the region and Ontario. The NDP has a plan to put mental health care under OHIP and declare the opioid crisis a public health emergency and move forward with consumption and treatment sites in Ontario. The Cambridge Memorial Hospital has identified that the one-time funding for 22 acute beds needs to continue past 2023. The NDP will restore hospital funding and make sure that it always keeps up with inflation, population growth, aging, and the unique needs of our community. I also know that the Cambridge Memorial Hospital has applied to have a dialysis unit, and this is needed in the region and in southwestern Ontario. And I would, while that's not in our platform, I would advocate with the party for this funding.
All right, Green Party, we will go to you next.
We have a healthcare system that really relies heavily on nurses, be it in our hospitals, in long-term care, just family practice. The Ontario Nurses Association says that we're 16,000 nurses short. I think that's very conservative in the estimate. I'm advocating that we hire at least 20,000 nurses. We could afford that if we just simply reversed the license plate rebate fees that we're given. $1.1 billion would pay for 20,000 nurses to be hired and their benefits and their salaries. Mental health is something that I'd seen as a huge issue during my police career in this community. If we don't address mental health on the upfront, the debilitation in people's lives, the drug addiction, the homelessness, and incarceration into jail is where most people in jail are mentally unwell. So we need to do that. And I'm glad that other parties are starting to get on board to support that, like the Greens have for so long.
And finally, Ontario Liberal Party.
Well, thank you. Our health is the most important priority. And as a matter of fact, the pandemic has underscored the need for more permanent hospital capacity to handle whatever it comes our way. When you or loved one is hurt, sick, or need of help, nothing else matters. Yet the people who take care of us, nurses, doctors, personal support workers, and the other healthcare professionals, took two big hits these past 4 years. The Ford Conservatives' reckless cuts and an unprecedented pandemic. Today, is too many healthcare workers are leaving the field after fleeing burnout. So what we're doing as Liberals is hire 100,000 new nurses and doctors, clear the surgical and diagnostic backlog, ensure access to doctors or nurses, grow the number of hospitals beds by 20%, and cover more medication costs, and get more people mental health help, save lives in the opioid crisis.
I'm just going to take an opportunity to remind those viewing that if you have a question for the candidates, you are welcome to put that into the chat. So on to question 3. The pandemic has highlighted how we undervalue workers in the care economy. For example, there are currently over 300 nursing vacancies in the Waterloo region. Many helping professions are seeing a crisis in availability of qualified workers due to redeployment, attrition, burnout and stress, and Bill 124. How will you support the backlog of patients requiring surgeries and diagnostic procedures without the availability of qualified healthcare professionals? How will you address the healthcare waitlists created from the pandemic? And Green Party, we're going to go to you first.
Thank you. The University Health Network tried something which I found to be very interesting. Without having more resources, they decided to dedicate 5 fully staffed surgical rooms strictly to receive unanticipated surgeries like broken legs, gunshot victims, what have you. And by having those set aside, it allowed all of the regularly scheduled surgeries in the regular surgical surgery rooms to be completed. Not a one was delayed or had to be rescheduled to be preempted by an emergency. And the 5 that were set aside strictly for emergencies were busy 80% of the time. So it kept the domino effect of people being rescheduled and rescheduled. It got rid of that. So it's this kind of innovative thinking that we can use our resources to the maximum benefit. There's other things I'm sure we can find like this. We need to put our minds together.
And Ontario Liberal Party, you are up next.
Well, there is a critical shortage of healthcare workers in Ontario, and to create the staffing we'll need, as we expand our healthcare capacity and replace retiring workers, we will train and hire 100,000 new healthcare professionals to meet demand over the next 6 years, prioritizing full-time roles across the health system, including a target of 70% jobs in long-term care homes being full-time. And we will ensure access to a doctor or nurse within 24 hours. Ontario Liberals will ensure access to a family doctor or nurse practitioner within 24 hours, increase the number of family doctors and nurse practitioners across Ontario, and create 15 new community health centers. And why do I say community health centers? In this riding particularly, Hespeler is growing, and there's about 30,000 and more folks living here. And there is absolutely no place for communities to go other than travel to Cambridge or Kitchener. Thank you.
And NDP, you are up.
Okay, thank you. So the pandemic has exposed how badly broken our hospital system is, especially when it comes to understaffing. Our nurses, doctors, and other health professionals are the glue that hold the system together, and they're being run off their feet, still unable to give every patient the time and attention that they'd like to. Bill 124 is freezing wages of healthcare workers behind inflation, and disrespected, burnt out healthcare professionals like nurses are leaving the profession in droves. The cuts have been happening for far too long, and the latest budget has ignored healthcare workers once again. The NDP has a plan to place a moratorium on any further layoffs of nurses and healthcare workers, and will bring healthcare partners together to complete a comprehensive view of staffing needs. We'll immediately take action to hire at least 10,000 personal support workers and 30,000 nurses across the health sector, scrap on 124, and tackle the wait list of surgeries and procedures.
Thank you very much. On to our next question. The current wait for accessible counseling in Cambridge is over 6 months. Despite the growing mental health crisis, community counseling agencies like Family Counselling Centre of Cambridge and North Dumfries have not received an increase in funding in years, meaning that the wait for support is growing. What will your party do, and what will you do personally to address waiting lists for mental health supports? And Ontario Liberal Party, we're going to start with Ismail.
Well, thank you, Tara. There are a lot of new pressures on people's mental health. The pandemic, a global conflict, social media, climate change, people, and especially our kids and younger Ontarians are feeling more stressed, anxious, and depressed, and they need help. But right now, there's a major gap between wanting mental health help and finding it. So we will reverse the Ford Conservatives' deep cuts to mental health care and connect more people to mental health support by investing an additional $3 billion over 4 years in mental health and addiction services. This will expand coverage and reduce wait time for OHIP covered mental health care for those that need it, including psychotherapy, also providing free mental health first aid and guided online mental health support to everyone, to make sure our kids get help without waiting. We will hire 1,000 more mental health professionals for children and make mental health first aid. Thank you.
And Joanne Weston of the NDP, you are up next.
Okay. The pandemic has been an emotional and psychological strain for adults, youth, children, as they've been isolated with financial pressures and loss. There's too many people that are forced to go without mental health care and are waiting too long on lists for treatment and crisis intervention. The NDP is committed to providing universal mental health support because mental health care is health care. Every person in Ontario, regardless of their job or benefit coverage, should have access to the mental health supports when they need it. We will offer no-cost counseling and therapy for all Ontarians. We'll ensure public access to psychotherapy for approximately 500,000 Ontarians with mental health needs who don't currently have access. We'll double the funding for mental health staff and supports in schools so kids have someone to turn to. Individually, I will advocate with my party to seek and build partnerships with local municipal partners.
And David Weber, you are up next.
Thank you. I'm really pleased that this issue is getting the attention that it is now and that more political parties are starting to get on board while the Green Party has been crying in the wilderness on this for so long. We want to have the standalone Ministry of Health for mental health and addictions, with it receiving 10% of the healthcare budget from the province. Expand the mental health coverage that it is available for people at an affordable price or free when they need it and where they need it. We need to have a 3-digit phone number like 911 where you can call, speak to someone who can put you into direct contact, not just talk to you, but put you into direct contact with someone who can counsel and help you at that moment for what you need, and to dispatch readily available crisis response teams instead of police to come to you and give you the assistance you need when you need it with the follow-up care. That's what we need to do.
Following a planning study completed by the City of Cambridge, a preferred site for a safe consumption and treatment services has been selected. What is your party's position? And if elected as the MPP, would you work collaboratively with the municipalities to ensure the timely opening and sustainability of a CTS in Cambridge? And NDP, we are going to go to you first.
Opioid related deaths are on the rise, and the crisis continues to ruin lives and devastate families across Ontario. In the first 6 months of the pandemic, over 1,200 people died. That's an average of 6 people a day. As the candidate for Kitchener South Hespeler, I support a consumption and treatment site to help the members of our community that are struggling with addiction. We know that consumption and treatment sites save lives. The NDP will declare an opioid crisis a public health emergency and invest in harm reduction strategies immediately. We'll fund mental health and addiction infrastructure that our community needs. And will address the social determinants of health, such as poverty and lack of affordable housing of people living with addiction. We believe in working with stakeholders and other levels of government to make lives better for people suffering from mental health and addiction. And I believe in working closely with municipal partners on these.
And Green Party of Ontario, you are up next.
Having been a police officer in this region, having worked in Hespeler before I retired, I had seen the horrible conditions that we had in our community, the neglect in not having the services that are required for people with drug addictions. When we talk about these opioid overdose and opioid deaths, I was going with paramedics to calls, drug calls, giving naloxone and watching people barely survive, and also knowing that many did not. And to see this level of heartbreak and death in our community, much worse than during the COVID crisis, this is pressing, and it's something that we need to be compassionate about, to put our arms around someone's shoulder and say, I'm here for you to help you. And the CTS, the emphasis has to be on treatment services, otherwise it's not going to work. But yes, I support it. We need to.
And Ontario Liberal Party, you are up. Ismail, you are muted right now.
Oh, sorry, thank you. So I just wanted to say that, first of all, thank you, Tara. And second, I happen to work in the community. My current job is actually running a community center. And one of the things that I've done is working with partners and collaborated with partners such as Chrysler and House of Friendship and Foodbank and so on and so forth. I see these issues right in front of me every single day when I go to work. So deaths related to opioids use addiction have seen a staggering rise in our region, and we need to fight it. And the Liberal government is investing $300 million across the addiction sector to prevent, intervene, and treat opioid addictions and overdoses, including providing an ample supply of Naloxone kits, fentanyl testing strips, and harm reduction supplies at pharmacies, community spaces with first responders. We will target organized crime groups and produce traffic illicit drugs while ensuring those with drug use.
Thank you very much, everybody, for those responses. The current shelter allowance for a single person on ODSP is $497 a month. And for those on Ontario Works, it is $390 a month. The average rent for a one-bedroom in Cambridge is $1,462 a month, and many know that that price is hard to find. Meanwhile, the average cost of a detached home in the region is now over $1 million. Our question is, what is your party's plan to invest in safe and affordable housing? And what about supportive housing? And Green Party of Ontario, we are going to you first.
Thank you. Dealing with safe and affordable, we need to have a roof over everyone's head. We need to have wraparound services for mental health and drug addictions. Our plan is to do what is called for by the recommendations of experts, and most of us are in agreement. 60,000 supportive homes with 160,000 homes for affordability. But the wraparound services for those that definitely need those supports with mental health, drug addictions, needed. As for people that are looking to try to buy a family home, we need to stop the egregious and oppressive commodification of housing by domestic corporations that all the major political parties, other than the Greens, are disregarding. We're blaming it on lack of supply when it's really throttled supply is the primary issue based on domestic corporations buying up and holding empty in often cases properties, making it more difficult for you, and you can't outcompete a corporation to buy a home.
Ontario Liberal Party, we look to you for the next response.
Well, working in the community every single day, I get to see and witness these issues that we're raising at the moment. But as a Liberal candidate, this is one of the reasons why I put my name in the hat, is supportive housing pairs affordable homes with professional services and is an effective way to prevent homelessness. For instance, seniors and people with development disabilities can live independently with accessible help. Likewise, those struggling with mental health and addictions can live in a safe environment with access to counseling. We will provide municipal and non-for-profit partners with $360 million annually to operate and improve social, supportive, and community housing services, funding that will increase as 38,000 new homes are completed.
All right, and on to the New Democratic Party.
Thank you. Housing is absolutely the number1 issue that I'm hearing as I'm taught out in the community. All different age groups and demographics, whether they're worried whether they can afford a home, whether they can afford their rent on the next month. Ontario has a housing crisis, one of affordability, supply, and need. We believe that housing is a right. Everyone should have a safe place to lay their head at night. And from that, other issues will flow. So the NDP housing platform, Homes You Can Afford, will tackle the housing crisis from multiple angles. We're going to build 100,000 new affordable homes and extend the lifespan of 2,600 260, existing homes, and will build 60,000 supportive housing units and restore the goal of ending chronic homelessness within 10 years. And will re-implement rent control and tax investors that leave homes vacant.
Thank you very much. So on to our next question. The childcare deal reached between Ontario and the federal government was historic. However, as YWCA Cambridge and advocates across the province have laid out clearly, the deal does nothing to address the current and worsening labor force crisis. The $18 an hour wage floor will not address retention issues or attract new staff, nor does it provide for professional wages such work deserves. In addition to this, the deal as it currently stands does not account for how the 86,000 proposed new childcare spaces will actually be built. Childcare Now has pointed out that it costs about $50,000 to construct one new quality space. This not including the costs of land or purchase of property. If these significant flaws in the deal are not corrected, it's hard to believe Ontario will successfully develop a universal, affordable, and accessible childcare system that benefits all families with children. What will your government do to ensure the success of the National Childcare Plan in Ontario? And Ismail, we're going to go to you first.
Thank you, Joanne. And this is something that Ontario Liberals will support. And what I could say to you is parents in Ontario can linger on wait lists for years to access childcare, in large part because of lack of qualified staff to welcome more kids. We'll create 30,000 new jobs for early childhood educators and other childcare staff to build capacity in workplaces, schools, and community spaces where they need it most. Giving these workers a better pay and benefits and bringing in compensation grid in line with full day kindergarten as well will ensure ECE are well equipped to help kids flourish, providing free tuition for all ECE programs at Ontario's colleges and improving recruitment, retention, and professional development opportunities for lifelong learning. Thank you.
All right, and we will go to the NDP next.
Thank you. The pandemic showed us how important childcare is. So many women left the workforce to take care of kids because there wasn't enough childcare available. The NDP has a plan to immediately increase the wage floor for childcare workers to $25 per hour for registered early childhood educators and $20 per hour for all other program staff. We are going to implement 10 permanent sick days and work with the childcare sector to bring a workforce strategy to make a job in childcare into a career. This includes developing a wage grid and decent work conditions, including benefits, pension, paid planning and development time, and a strategy to help childcare workers upgrade their qualifications. We will increase base funding for licensed home-based childcare and provide stable funding to home-based childcare agencies so they can offer more support and training. And we'll work with the federal government to speed up the implementation of $10 a day childcare.
Green Party, you are up.
Being understaffed, overworked, and underpaid, which is what causes the burnouts in our nursing careers, is the same thing that's causing it in our childcare workers. Capping their pay the way we're doing under this current system and not having enough facilities are two big problems that we need to address. It's kind of in line with a lot of other problems we have, where 20% of our construction workforce is going to be retiring over the next 10 years. So we need to replace those. And as our communities are growing, we need even more. So it's on many, many fronts, which brings me to one solution that I think is required to address all of these various careers. And that is what the Green Party has been arguing for a very long time: post-secondary education, tuition-free, university, college, and the trades. We need to educate people, make it easy for them to be educated, regardless of their financial ability or their current situation, so that we can fill the positions of these jobs.
All right, and the final question from me this evening is: the Ministry of Education funding for Ontario's 72 school boards fell by an average of $800 per student from 2017-2018 to 2021-22. A new analysis from the Canadian Centre for Policy Alternatives shows. Many parents are worried about the learning gap that many children have fallen into during the pandemic and repeated shutdowns, along with a growing child and youth mental health crisis. What are your party's priorities for education, and how and where will you invest? And NDP, we are going to look to you first.
Okay, thank you. So I have served my community as a volunteer for 10 years before becoming a trustee in 2018. My focus as both has been on education, academic and well-being, and youth mental health. As a trustee, I saw firsthand how our youth struggled with online learning during the pandemic, and the latest budget, the government has once again cut funding for education and has indicated that they are moving forward with mandatory online learning for students. And we know that students learn best with a teacher in a classroom. So we will kill mandatory learning. We will get rid of it. And we will lower class sizes, hire thousands of teachers and education workers. We'll give special education and emotional supports they need more than ever. And we'll kill Bill 124.
Green Party of Ontario, you are next.
Thank you. The class sizes do need to be capped at 20 students, and we need to have adequate staffing for that, as well as end mandatory online learning, which has been proven an absolute failure for so many students. The cuts that have been given to education, 700 million is the shortfall. We need to immediately restore that funding and increase the funding at least 2% per year for coming years. We need to end the EQAO testing, and that's going to save some money. But we also need to look at the school boards to save some money there and reinvest. It's the unpopular issue that many people don't like, but it's a United Nations statement that having a separate school board where you have to be a certain religion to be hired to actually get work, schooling is the only career that allows that discrimination. We need to merge the school boards and save money that way and invest it in students.
And finally, we will hear from the Ontario Liberal Party.
First off, 4 of my kids go to public school, and this is a presentation matters to me a lot, and I feel it and I hear it from my kids of what is happening right now, how our education is a bit broken. So as our kids try to catch up on learning lost during the pandemic, they need their teachers' focus and attention more than ever. They cannot just teach, but reach them. While the Ford Conservative try to cut education funding and raise class sizes, we will cap class sizes at 20 students in every grade across the province. Starting first with the schools, where this would have the biggest impact. Capping class sizes means we'll need more teachers. To reach this goal, we will recruit teachers from other provinces, including those whose religious freedom are being threatened by Quebec Bill 21. We will also help qualified teachers immigrate to Ontario and attract some of the 80,000 Ontario certified teachers not currently employed by schools back to the teaching profession.
Thank you very much, everybody, for all of your answers. We are going to turn the floor over to Dr. Sharon Ball, who will open up the floor for some audience questions as well. So Dr. Ball, you are up.
I think my video isn't on, but thank you very much, Tara, and thank you to the candidates for your answers. We'll start with the following question. This question comes from a local long-term care administrator. Several of our long-term care homes have been awarded beds, which are very much needed in this community. However, escalating construction costs and increased interest rates are causing operators to pause and reconsider whether or not building will be possible. What type of investment are you prepared to make to ensure these projects move forward? And I'll start with the Ontario Liberal Party.
Sorry, we're talking about the long-term care, right?
That's correct.
Yeah, so one of the things that we're doing is with the long-term care is that we are getting rid of the for-profit and making sure that we support our non-for-profit and also invest in creating, increasing the pay for our PSWs and the nurses, so they're able to support our seniors at home. So we're keeping all our seniors at home, and that's where we're spending a lot of investment and making sure that they're part of their seniors are part of their community.
Thank you very much. I'll turn to the NDP candidate next.
Thank you. So our plan is to take the profit out of long-term care. We will invest in smaller, non-institutional, community-based, community-sized homes of long-term care where our seniors can live in dignity as they age with the support they need. We'll be hiring more personal support workers and nurses and doing away with Bill 124 that is driving people out of the profession. And we will improve in-home care with long-term care, we will implement a 4-hour standard of care for long-term care. And in-home care, we will hire more personal support workers to ensure that seniors can live at home as long as possible with the support they need, living in dignity until they need the long-term care support that they deserve. Thank you.
Thank you so much. And we'll turn to our Green Party candidate.
I really can't disagree with anything that I've heard. The progressive parties really are aligned with everything that was just said there. So there's one thing I would like to share a little bit different. Our Ontario Disabilities Act of Ontario is set to bring in by 2025 fully accessible businesses and change the design of our homes, wider doors, hallways, bathrooms to be more accessible, not just for you to be able to age in place, but if you have a friend or a family member that wants to come visit you, they should be able to get in and out of your home. And until we actually start to do these universal designs, it's really, really hard in the future to have our aging population to be able to age in place and stay at home and follow these Nordic models of being able to stay home and have your care come to you for what you do need. But everything else, you know, expanding our public health care and ending private for profit, it's something we must do. It's a crisis situation to be scalping money to those private corporations.
Thank you so much. Next question. This question comes from our friends at the Waterloo Region Immigration Partnership. Ontario's healthcare system needs major investment in infrastructure and people to meet the needs of a population growing and changing through immigration. Internationally trained doctors and nurses are ready to work, but can't because of regulatory barriers. Significant investments in health equity measures like interpretation are needed so that diverse populations get the care they need. At least $250,000 is needed just for this in Waterloo, Wellington. Will you support investments that meet these pressing community needs? And I'll start with our NDP candidate, please.
Thank you. Absolutely, we need to bring our internationally trained healthcare providers, speed up their certification so that they can work locally and support our healthcare system. We know that some are going over into this, going over the border, living in Canada, working in the United States. And so we are losing that capacity in our healthcare system. So we need to do what we can to ensure that our internationally trained healthcare professionals and other professionals are able to work locally and support our needs here.
Thank you. Same question to the Ontario Liberal Party candidate.
I couldn't agree more. Part of my advocacy piece, this is what I do. We have a lot of educated foreign that has foreign credentials that is really driving Uber now and also working in the trades. We're not investing in that, and we're not making sure that these folks are part of this conversation. So Ontario Liberals are committed to hiring 100,000 healthcare workers, prioritizing full-time roles, and also hire internationally trained health professionals. Our region needs it. We're growing. We're the fastest growing region in Canada. So as the population grows, our health system has to get bigger. We only have few hospitals, and we need to advocate to getting more health buildings or creating more spaces for folks to come and work here. So I absolutely agree.
Thank you. And to our Green Party candidate.
From car crashes to domestic assaults, I was in the hospital almost on a daily basis in policing, also dealing with those opioid crisis incidents. I was told back in 2014 that ending hallway medicine was a priority. And at that time, we had been wrapping up a 15-year Liberal government, and then we moved into the Conservative era, and we have not seen that situation improve. My peers in policing are still finding, coming into what seems to be so understaffed and underfunded and unable to care for people, that we need to increase the funding, and we need to deal with it. That does come from supporting our immigrant foreign credentials for doctors. My doctor was a foreign immigrant that had a nightmare in trying to become qualified, and he's retired, and now I don't have a doctor. Ontario places 7 out of 10 provinces to the level of doctors we have.
Thank you. Questions have come in, including one previously on housing affordability. This is a sort of a flavor of that, a very important question, so I'm going to ask it. One of the biggest groups that has been left behind by housing policy over the last 10 years is renters. With the cost of living rising and loopholes that allow landlords to raise rents to whatever the market rate is after each tenancy, renters are feeling the squeeze, and many are finding themselves priced out of our rental market. What will your party specifically do to support renters, and how do you propose we change the Ontario housing system to work better for everyone? And I will start with our Green Party candidate, please.
We need to replace those rent controls that have been repealed since 2018 for new builds. We need to have them in place just like that pre-2018. We need to control that rent between tenancies, so people, when they get evicted for renovations, and some of them are just IKEA renovations, so that the tenant can, or the owner can put up the value of the rent. That needs to stop. We need to have a better tribunal system, which doesn't delay for over a year. When a tenant and a landlord need to have a resolution to an issue, that needs to be done in a more timely manner. So we need to increase the availability and the access and the response for these landlord-tenant tribunals to within a very short window of 2, 3, or 4 months. The rents are going high largely because people aren't leaving the apartments to go into homes because they're unaffordable. Again, we need to stop the domestic commodification of housing.
Thank you. I'm going to go to our NDP candidate next.
Thank you. So I am the mother of 3 young adults who are, and this topic comes up at our dinner table quite often as they wonder if they'll ever be able to afford rent to move out. I'm also as I said, talking to lots of people in the community where this is a concern, we need to re-implement rent control so that houses are not being, the rent for houses is not going up $400 and $500 in a day as one tenant moves out and the next tenant moves in. That is making the prices of rent go out of control. We need to end rent evictions so that the bad actors are not kicking people out, just putting a coat of paint on and then again, jacking up the rent. And we need to increase the supply of affordable units that people can live in safely.
And our final candidate.
Well, first, let me begin by saying that I am one of the families that are really struggling to find a house right now. My wife is a registered nurse, and I work for the city of Kitchener, and we get paid well. And we're struggling to have to buy a home because right now we live in a co-op. So that gives you an understanding of what this means to me. The region of Waterloo oversees roughly 5,600 affordable housing units through different programs like Waterloo Region Housing and the region's rent supplement program. The average wait time is roughly 7 years. So what are we doing to help? An Ontario Liberal government will get at least 1.5 million new homes built in Ontario over the next 10 years, doubling the space of building from the past decade. Local communities know best when it comes to where and how to build more homes. So we'll make sure they have the resources they need to improve housing as quickly and responsibly as possible.
Thank you. The Black Lives Matter movement, along with many allies and social service organizations, have called for a reallocation of funding from policing to social and health supports for underserved communities. What is your opinion on this issue, and how will your government approach policing? I'll start with our Liberal Party candidate first.
Okay, I believe that this subject line is something that really hits home for me because, as I said earlier, I'm one of the folks who, the founders of African Caribbean and Blacks Network, as well as the Black Lives Matter. I've been involved in the Black Lives Matter movement. I believe that where we put our monies and how we fund should be looked at very carefully. I work with communities and I see a lot of folks in the midnight at times who have mental health. Police are really dealing with it, and the money that the police is getting, those folks who work there is 9 to 5, so they don't work overnight, so they don't have the equipment where our funding is going to the police. So I do agree, we need to reevaluate that. We need to make sure we need to invest these monies where it needs to go.
Thank you. We'll move next to our NDP candidate. Same question.
Thank you. We need to make sure that our community is served by the people that are best trained to handle the concern in front of them. So if it is a mental health concern, the police are perhaps not the best trained to do that. We could use social services, social workers to support mental health calls. The NDP will support police training on human rights and systemic racism, but we need to make sure that the right people are serving our community that are serving the needs of our community when they need it. The Ontario NDP is the first in Canada to have a Black caucus and established to ensure that Black voices and perspectives are heard in the legislature and will inform the work of the NDP.
Thank you. Same question to our Green Party candidate, please.
Who is a retired police officer from Waterloo Region for 30 years, I can tell you that all of my peers that I worked with would be embracing gratefully the support services in the community for mental health and many other social services that we are called to try to navigate problems between neighbors, parent with discipline issues with children, and calling the police for it is really not the appropriate way to be going. There are frauds, there are break and enters, there are car crashes, there are all kinds of things that police are needed for. And when I first got hired in policing, there were about 12 people per shift in Waterloo, Kitchener, and Cambridge. And when I retired from there 30 years later, it was about the same, and the region had tripled in size. Cutting policing is not really the ideal. What they need is resources funded elsewhere to complement and take over the burden from police and assign the duties to the people that are best able to deal with it.
Thank you so much. I'm going to turn to, I think, what was a very interesting question on priorities. So from the audience, what would be your priority as an MPP, if elected, for your first private member's bill? And I'll start with our Green Party candidate, please.
Proportional representation. We need, when people to vote, that they can feel confident that when they vote for a given person, a party perhaps, that that vote contributes towards the strength of the outcome, and that the outcome, the percent of seats equals the percent of votes. It eliminates strategic voting where people vote for a party they don't even like to avoid something they hate, which undermines the democratic principle of voting for who you feel is your best representative. More and more people are getting beyond this, even with our flawed first past the post, and they're voting for something they want to support and have it grow until they get it. But they shouldn't have to be forced to try to be that brave. They should just be able to vote for what they want and know that their vote counts towards getting it. Ranking ballots is great if you have proportional representation, but the Liberal plan, provincial or federal, talking about ranked ballots but without having PR, simply takes smaller parties' votes and reallocates them.
Thank you. Let's turn to our NDP candidate next.
Thank you. This is a really good question. My mind goes to today is International Day Against Homophobia, Transphobia, and Biphobia. And I think my first private member's bill would be to address those issues in our community, similar to how the NDP has brought forward a the London Family Act that is against Islamophobia and other forms of racism. We need to combat all hate in our community, including homophobia and transphobia, so that 2S LGBTQ people can live safely in our community without fear of being targeted, and not be denied homes or healthcare when they need it.
Thank you. And to our Liberal Party candidate next.
I think developing policies is very, very important, because I think if you want to tackle an issue, you have to make sure that we create a good legislator for the community. The first thing that I would do is, honestly, is as a member, if I become a member of provincial parliament, to make sure that we teach in our schools the Indigenous history and culture, so our kids know what the Indigenous community went through, and I will push that. Our party is pushing it to make sure that we create that curriculum in our schools.
Thank you. I'm going to go to the next question that comes to us from our friends at Shore Center, and originally appeared in the Feminist Shift All Candidates survey. Access to reproductive care, including abortion care and birth control, remains riddled with barriers in Ontario. Community members are often forced to travel out of town, take additional time off work, incur significant personal costs, and or choose between abortion, birth control, and paying their bills. How will your government ensure access to reproductive health care for all Ontarians, and will you commit to universal birth control coverage in Ontario? I'll start with our NDP candidate first, please.
Thank you. I was pleased to fill out the Feminist Shift survey because women's issues are so important to all of us. And I know that as we hear the possibility in the United States may again deny women the right to control their own body, I know people are scared and sad and furious. I believe in respecting people's rights to make decisions about their own body and their own lives. Everyone deserves safe, accessible abortion and reproductive healthcare services, no matter where they live or how much money they make. Cost should not be a barrier to an individual's ability to make choices about their reproductive health. And we need to make, the NDP has a plan to make contraception free for all Ontarians. We believe that women have the right, freedom, and capability to control their own bodies and make their own health choices. We will rebuild and improve healthcare by investing, not cutting. And we will launch.
Thank you. We'll go next to our Liberal Party candidate.
Even though this issue is something that I don't think men should be asked to be involved, I think it's something that we can all agree on, that we need to support and make sure that this is done right. So Ontario Liberals is proposing will provide free ministerial products at all schools, libraries, community centers, transit stations, and health services. We'll also create an Ontario Women's Health Strategy to make the health system responsive to women's health needs, including maintaining publicly funded abortion services and reproductive health programs currently available and expanding access to fertility treatments, early pregnancy loss, and prenatal mental health services. And this includes expanding the Ontario fertility program to cover once the cycle of egg freezing and so on and so forth. Thank you.
Thank you. And next to our Green Party candidate.
The answer is yes. I support universally available birth control coverage. Reproductive health is part of health, and we should have all health services covered in a pharmacare. So it's not just birth control pills, but all your medications and your healthcare needs should be covered. And that would include also vision, dental, hearing. I don't know why we parse people's bodies up and say we will take care of you and help you in one area of your health if you have a tumor or a cancer, but if you have some other problem like with your hearing or your dental, or if you need help in Planned Parenthood, we're going to abandon you. That's not right to do. And we need to properly fund the abortion services so that people don't have to travel out of Ontario. We need to be able to have healthcare available to wherever people require it. And asking people to pack up and cross country, that's not right.
Thank you. Next question. At a local level, there has been a growing focus on racism, homophobia, Islamophobia, and other experiences of racism and inequity. What is your plan to address these issues within the education system? And I'll start with our Green Party candidate.
We need more counselors within the education system. We need more teachers' assistants. We need people that are trained to be able to interact with the children and give them proper guidance and direction. We need to have course material that is more reflective to help people be more compassionate and loving towards one another, teaching them the basics of how to share, all the way up to respecting one another's opinions and how to resolve differences and how to respect differences. These are things that if we don't do when people are young, it is very, very hard to change them when they're older. And I also would say it's very easy to do it when they're young because most children by their nature are very much loving and open and consider differences to really not be there as much as what adults do. It's the parents of some children that influence them negatively that we need to help in society counteract. So we also do need to educate adults, maybe bring them in with their children to more social encounters.
Thank you. And next to our NDP candidate.
So as I mentioned, today is International Day of Homophobia, Transphobia, and Biphobia, and too many 2S LGBTQ persons live, work, and live under the shadow of discrimination, violence, and fear for simply being themselves. Youth in schools are no different. And education is an important way to unlearn hate and create inclusive and safe schools and communities. I agree we need more adults, safe, caring adults in our schools to help and support our students, including child and youth workers and social workers, but teachers also that understand and care. No one should ever feel that they or their loved ones are targeted by hate or harassment. We do have a plan to create a 2S LGBTQ inclusion action plan that will include education.
Thank you. And to our Liberal candidate.
Well, I'm going to say this unapologetically, that as a person of minority and somebody who actually goes through these issues of hate and racism, and because my name is Ismail Mohamed, I'm Muslim, so I'm also a Black man, so it just comes twice. So I chose to be part of the Liberals because they have done a great job, and we're doing it right now. And the things that we are proposing at this moment with this new Ontario is reverse funding cuts to anti-racism programs, better investigate hate crimes and human rights complaints, protect religious institutions from violence and intimidation, pass our London Family Act to create new tools and strategies to combat racism, appoint a standalone minister responsible for anti-racism. Those are the things that we will do. It's not what I believe only, but that's the actionable thing that needs to happen.
Thank you. And that ends the question portion of the evening. May I say, by the way, how appreciative I have been, and I think all of us have been, with respect to the tone and the candor and the openness of the candidates, and your incredible ability to compress complex answers into that dreaded 1 minute time frame is very appreciated. We will now give each candidate 30 seconds for closing remarks, and I'll start with our Liberal candidate.
You start with me, Doctor?
That's correct, yes.
Okay, so with the track record of developing and implementing successful partnerships as a community leader, I think I'm uniquely prepared to serve Kitchener-South Hespeler as a member of provincial parliament, because I live here, work here, and play here. And I believe the importance of strengthening communities by valuing the needs of all socioeconomic groups. Kitchener-South Hespeler needs leadership that can work with diverse residents of our riding. Whenever possible, I have partnered with community members and organizations to implement sustainable solutions. I will use these skills to improve the quality of our lives. The Liberal Party is a party committed to you, the people, and people over politics. Thank you.
Thank you. Our Green Party candidate next.
The reason why I said my first private members bill would be for proportional representation is because I believe that everybody's opinion should be able to be heard, discussed, understand one another, and then make policy that is in the community's best interest. We are better when we work together. When we're working together, we can see things that we would not see when we're doing it alone. When we have a 34% or 36% of the vote become a false majority and what they say goes is not right. Even under our flawed system, I have the personality to want to work bridges built to other parties, to other MPPs, to share our ideas and work together for the common good. This is what we're supposed to do as representatives, to care about our community and to bring their interests forward to government. This is my pledge to you that I will do this. I will represent you with honesty and integrity to the best of my ability for your interests before my party or before my own interests. On June 2nd, I ask that you vote for me. And in the meantime, take a look at the gpo.ca website, check out my website, davidforksh.ca. If you have any questions, reach out to me.
Thank you. And now to our NDP candidate.
Thank you. One of my favorite parts of being a trustee is being in schools and at events, listening and learning from students, staff, and the community about how to make schools better. As an MPP, I will be out in the community listening and bringing those voices and ideas to Queen's Park, working with community organizations, working with community members, and advocating for the needs of the people of Kitchener South Hespeler. This has been my home, Hespeler and Kitchener South, for more than 25 years. I've raised my family here. I love this community, and I look forward to bringing your voices to Queen's Park as your representative. And I hope you'll consider me on June 2nd. Thank you.
Thank you very much to all of you. We want to thank the organizers again for arranging this important event on these important topics. The candidates for taking the time with us. Thank you again to Ismail Mohamed, to Joanne Weston, and to David Weber. And most especially, thank you to the viewers who will make the most important decision. We hope that this event has been helpful to you, and we want to thank all of you very much for participating. Have a wonderful evening.
Thank you.
Buddy. Welcome, everyone. So welcome to our all candidates meeting on the future of health and social services in Cambridge. My name is Tara Kleinstuber from the YWCA Cambridge, and I am joined as moderator by Dr. Sharon Ball of the Cambridge and North Dumfries, Ontario Health Team. First, we would like to acknowledge that this event is being hosted on the lands within the Haldimand Treaty of 1784, a formal agreement acknowledging 6 miles on either side of the Grand River as treaty territory belonging to 6 nations of the Grand River. This is the traditional territories of the neutral Anishinaabe and Haudenosaunee peoples, and we honor their stewardship past, present, and future. The Ontario election is being held on June 2nd, and we hope that this session will help you make your decision about who should represent our community. This event is being hosted by the Cambridge and North Dumfries Ontario Health Team, Family Counselling Centre of Cambridge and North Dumfries, YWCA Cambridge, the Cambridge Shelter Corporation, and the Cambridge Foodbank. We are thankful for all of the candidates who have committed their time to this event and for putting their names forward to represent our communities. Our candidates joining us this evening from the Cambridge North Dumfries riding are Surekha Shenoy of the Ontario Liberal Party, Marjorie Knight of the New Democratic Party, and Carla Johnson of the Green Party of Ontario. All candidates running in these ridings were invited to participate, with absent candidates citing other commitments or not responding to invitations. The organizers of this event felt it was essential to have conversations around health and social services in our community. These past few years of the COVID-19 pandemic has really highlighted the many gaps and inequities in our community, and has put significant stress on the programs and supports that community members rely on. We hope that this session will shine a light on some of those issues and present the plans candidates will be bringing into this election. We will be asking questions about the healthcare system, mental health and addictions, childcare, poverty and social assistance, housing and homelessness, youth issues, and more. While we have prepared a set of questions, we are also inviting questions from the audience. If you have a question that you would like candidates to answer, please enter it into the chat, and you may hear your question addressed to the candidates later on. Now, we want to get right into the questions, but first I'm going to go over the rules. Questions will be presented by the moderators, and candidates will be asked to respond beginning in predetermined order and then rotating who answers first. Candidates will have a maximum of 1 minute to respond to the question. A timer will be set up on the screen so that candidates can see how much time that they have left. If a candidate is not finished and continues past their allotted time, their microphone will be muted so that the next candidate can answer. If a candidate mentions another candidate or party by name, the moderator will give the candidate named 30 seconds for a rebuttal after all candidates have answered the question. We will begin and end with opening and closing remarks from the candidates. The candidates were given a list of questions yesterday and have had time to prepare. And we expect a rigorous debate, but we also expect respectful communications. So without further ado, we are going to get into the questions. So the first question is simple. Please introduce yourself and why you are running to be the member of provincial parliament in this riding. So we are going to start with Surekha of the Ontario Liberal Party.
Thank you. Good evening. My name is Surekha Shenoy, your Liberal candidate for Cambridge. Those who know me have seen me work tirelessly in this region through my work as a board director and past chair of the Cambridge Memorial Hospital Foundation. Some of you may have attended the popular CMH diversity outreach dinners that I championed over 10 years ago. We connected with over 60 diverse communities in this region, as I believe it's important to have a dialogue with all communities in this region to make this an inclusive community. I currently sit on the board of directors for Hospice of Waterloo Region. I'm also one of the co-chairs for the East Indian Community Walkathon of Waterloo Region, which has raised over 400,000 for local hospitals. I mentor young professionals and small businesses to set them up for success. As a professional, I have a master's in industrial systems engineering and an MBA in finance and operations from Laurier. I'm here today hoping to make the case for you to choose me as your next MPP for Cambridge because I'm troubled by the numerous issues facing us, including housing prices, affordability, climate action, education, and the economy. Thank you.
And next we will go to Marjorie Knight of the New Democratic Party.
Thank you. My name is Marjorie Knight. I work in the Cambridge community as a family outreach worker, and I see and hear what's going on in my community. People are struggling. There's a struggle to find or maintain housing. Moms can't go to work because they can't afford childcare. The youth unable to find work and overburdened by student loans. It's time to invest in people. We are barely living. The ONDP has an ambitious vision that offers hope to us all. We will build houses that people need and can afford. We will bring back rent control. We will invest in the things that matter most to everyone: healthcare, education, and senior care, while being fiscally responsible in the choices we make. We will invest in the things that matter most to everyone: healthcare, education, and seniors care, being fiscally responsible in the choices we make. My name is Marjorie Knight. I'm running to be your next MPP. I believe that the people of Cambridge deserve better. You deserve an MPP who will fight for you. I am that person. Thank you.
And Carla Johnson of the Green Party of Ontario, you are up next.
Good evening. My name is Carla Johnson. Thank you so much for inviting me. I am honored to be here tonight. I'm a longtime Cambridge resident and an educator, and I've seen firsthand how our public institutions make our province a good place to live. They help create a good and caring society. For most of my life, I was a strategic voter, and recently I've had a shift in my thinking. I'm done focusing on what I don't want, and it's time to build what I do want. So I joined the Green Party of Ontario to do politics differently. The Greens are collaborative. We work across party lines. Good ideas are good ideas, no matter where they come from. We respect the experts, the scientists, the researchers who dedicate their extraordinary expertise to help us all. Even more importantly, we look at creating policies with long-term goals in mind to get out of the typical 4-year cycle. What kind of province do we want in 10, 20, 50 years from now? Our policies on this platform are creating a caring society, connected communities, and a new climate economy. We're here to work for the good of all Ontarians to create a more equitable province where our most vulnerable are cared for and our earth, air, and water are protected. Thank you very much.
Thank you very much for those introductions. Before I move on to the next question, I wanted to note that the Q&A feature is best for audience questions coming in. So if you could please put your questions into the Q&A feature instead of the chat box, so we can ensure that those questions do not get lost along the way. Okay, so let's get into our first question. So as COVID-19 enters the endemic phase, the health system looks for guidance from the next government. What do you see as priority areas for investment in healthcare in Cambridge and North Dumfries? We're going to go to Marjorie Knight of the NDP first to answer this question.
Thank you. It has been a difficult time for many in our community. An NDP government would immediately repeal Bill 124. It has caused many to leave our healthcare positions, leaving us in such a state with no staff. We need to implement immediately paid sick days, especially for those who are looking after our most vulnerable. We need to declare an opioid crisis as a public health emergency and invest in addiction rehabilitation, detox centers, and harm reduction strategies. We need to invest in our public health units. We need to continue to encourage vaccination and testing in our community to ensure everyone who is eligible has proper protection from COVID-19. And we need to learn from the mistakes made during the pandemic and make sure that healthcare workers are given the support and respect they need to deliver quality care to everyone.
Carla Johnson of the Green Party of Ontario, you are next.
Thank you very much. My sister has been a long-time nurse, and I've heard from the very beginning of this pandemic what a stressful time has been on the nursing staff. The lack of PPE, they're overworked, they're understaffed, and the staff just keep losing them over and over. They hire new and then they leave. There's so many better options besides working in a hospital. And it is I'm deeply, deeply concerned that I'm deeply concerned that our public institutions are being underfunded and undercared for to be sold off. We need to repeal Bill 124 immediately so that nurses can have a voice and we can get proper pay and attract more nurses. We need to strengthen the voice of public health to steer away from private enterprise. We can celebrate our Indigenous primary care community clinic right here in our community. Today, Patrick Gaskin sent a long list of needs. We simply need to look at people over profits, plain and simply. Pay our nurses, PSWs, educators, everyone. Don't call them heroes, pay them properly. Get our hospitals are stable and create a robust system of primary publicly funded healthcare. Thank you.
Thank you very much. And now we will hear from Liberal candidate Surekha Shenoy.
Thank you. My top 3 priorities for investment in healthcare would be mental health. Liberals will invest $3 billion over 4 years in mental health and addiction services. The second area would be opioid crisis, drug overdose, and harm reduction. Liberals will invest $300 million to prevent, intervene, and treat opioid addiction and overdose crisis we face today. We will target organized crime groups and deceptive opioid manufacturers. We will make life-saving harm reduction supplies easily available, and we will build 15,000 more supportive homes dedicated to mental health and addictions. And lastly, addressing the backlog in surgeries. A Liberal government will invest $1 billion to address the backlog in surgeries caused by the incompetency of this government. Thank you.
You're welcome.
And again, before we move on, I will remind those who are joining us to use the Q&A feature for any questions that you might have as a viewer. And we will get to those questions in our second half of this meeting this evening. All right, so we'll go on to our next question. The pandemic has highlighted how we undervalue workers in the care economy. For example, there are currently over 300 nursing vacancies in the Waterloo region. Many helping professions are seeing a crisis in availability of qualified workers due to redeployment, attrition, burnout and stress, and Bill 124. How will you support the backlog of patients requiring surgeries and diagnostic procedures without the availability of qualified healthcare professionals? How will you address healthcare waitlists created by the pandemic? And Green Party of Ontario, we're going to look to you first.
Thank you. Well, what we need people doing it. We need people in our hospitals doing it. We need our nurses there who are our lifesavers, and they need to be there and they need to be properly supported, plain and simple. As you mentioned, Bill 124 has got to go. And I'm deeply concerned that it's not going to go and it's going to cause more problems. The Green Party would like to establish a nurse-led task force to make recommendations on these matters. There's also Bill 106, which has some very problematic sections in it too. Care workers need to be able to bargain for fair wages. So we propose a minimum hourly wage of $35 for registered practical nurses and a minimum of $25 for personal support workers to ensure that we're bringing in people and keeping them and rewarding them properly, because if we don't pay them properly, we're expecting them to work for free. So let's increase our nursing enrollment and fast track credentials of people who are coming in as international healthcare workers or new immigrants. There's lots of great qualified people out there that are new immigrants. Let's get them to work because they want to be a part of this. Thank you.
And Ontario Liberal Party, we will look to you next.
The Ford government called our healthcare workers heroes, then turned around and capped their salaries at 1% with Bill 124. In the midst of the pandemic, this government would not agree to paid sick leave. Nurses and healthcare professionals are leaving in droves due to burnout and not being valued and cared for. Only an incompetent government does not learn from past waves. We are in the sixth wave and still facing the same issues from the first wave: lack of testing, long wait times, etc. As of January of this year, average wait times in emergency departments was 44 hours, unacceptable at any count. An Ontario Liberal government will immediately repeal Bill 124, invest $1 billion to add capacity over the next 2 years to clear the surgical backlog, and will train and hire 100,000 nurses, doctors, and healthcare workers to replace retiring workers and increase the number of beds by 20%. Thank you.
And Marjorie Knight, you are up.
Thank you. Disrespected, burnt out healthcare workers are leaving in droves. You cannot deal with the backlog in our hospitals without responding to the staffing shortage. We need to hire healthcare workers immediately: nurses, doctors, physiotherapists, PSWs, technicians. The Ontario NDP has a concrete plan to recruit and retain our health workers. Health workers, especially PSWs, need full-time jobs with a decent wage, benefits, and paid sick days. We will take immediate action to begin hiring the 30,000 nurses that they say Ontario needs. We will expedite the recognition of nursing credentials of 15,000 internationally trained nurses so they can get to work immediately. We must do better, and we can do better. These are our heroes. We cannot turn them into zeros. We must work with them.
Thank you very much, everybody. We will move on to our next question. The current wait for accessible counseling in Cambridge is over 6 months. Despite the growing mental health crisis, community counseling agencies like Family Counselling Centre of Cambridge and North Dumfries have not received an increase in funding in years, meaning that the wait for support is growing. What will your party do, and what will you do personally to address waiting lists for mental health supports? Ontario Liberal Party, we're going to look to you first for this one.
Ontarians are feeling more stressed, anxious, and depressed, and they need help right now. There's a major gap between wanting mental health help and finding it. A Liberal plan will connect more people to mental health supports by investing an additional $3 billion over 4 years in mental health and addiction services. To address waiting times, we will train 3,000 new mental health and addictions professionals. We will expand coverage and reduce wait times for OHIP-covered mental health care for all who need it. We will require private employer benefits to include mental health services. We will also hire 1,000 mental health professionals for children to eliminate wait times. We will also provide a free mental health first aid and guided online mental health support services to everyone who needs it. Thank you.
Thank you very much. NDP, you are up next.
Thank you. The Ontario NDP has a plan to create universal mental health care in Ontario. We will create Mental Health Ontario. This organization is going to ensure that instead of paying with your credit card, you're paying with your OHIP card. We're bringing in a province-wide mental health standards, creating a basket of services and making sure that mental health and addiction programs are delivered comprehensively across Ontario. For me personally, working in the community, I'm working with so many different populations, and often we find that culturally relevant help is not to be found. And I was at a brunch the other day where I heard from a psychotherapist who said that we need to encourage our youth to get involved in this field so that we can start developing people from all across our country in this kind of work.
Thank you very much. We will move on to Carla Johnson of the Green Party of Ontario.
Now, I have to say, this is something I'm very proud of. So the Green Party, our platform is a caring society with connected communities and a new climate economy. And we were the very first party in Ontario's history to create a standalone, publicly funded mental health platform. Mental health is health. We would never ask someone with a broken arm to wait 18 months to get it fixed. It's absolutely atrocious that we expect that of people with mental health struggles. I can tell you from firsthand experience how mental health can affect the entire family. We need to see an increase in publicly funded healthcare. We want to see an accessible system with around-the-clock access to treat mental health and addiction as a public health issue, to expand support for addiction care, expand care options for people with complex needs, to increase our mental health spending to 10% of our health budget to include mental health under OHIP, to increase our funding for children's mental health, to reduce wait times to less than 30 days, and decriminalize drug use to improve lives, lower costs, and treat mental health as a public health issue. Thank you.
Thank you very much, everybody. Moving on. Following a planning study completed by the City of Cambridge, a preferred site for a safe consumption and treatment services has been selected. What is your party's position? And if elected as the MPP, would you work collaboratively with the municipalities to ensure the timely opening and sustainability of a CTS in Cambridge? NDP, I'm going to look to you first for this.
Thank you. The Ontario NDP is 100% behind CTS sites. I have been a longtime advocate for this in Cambridge. Doing nothing is not an option. It never was an option, and now we see why. This location works. There are supports for everything in that area. And you know, daily, there are people who are overdosing outside in that parking lot. And you know why? Because they know in that building, there are people who can help them. What we need to do is get them inside and start looking after them. Physical care, mental care, addictions help. We need to create a pipeline of getting these people the help that they need. And in doing this, we actually take the burden off of our emergency and our hospitals. We need to get this done, and as quickly as possible. I absolutely will do my best to work with everyone concerned to get this going.
Green Party of Ontario, you are next.
If anyone was following the consumption treatment services debate a couple of years ago, I was heavily involved. I was writing letters. One of my letters was read at the council meeting because I have been a vocal, staunch public supporter of a CTS site. Many of you know I have a niece that I'm very close to who struggled with a drug addiction and lived on her streets for about 10 years. And what I learned through her journey is horrific. The most vulnerable people in our city were left too long with far too supports and horrific consequences. This new location is great. I'm excited it's there and I'd be happy to go and volunteer. I'm excited to participate. The GPO platform says treat addiction as mental health, expand treatment options for people with complex needs. A part of our mental health is to keep it publicly funded, mental health and addiction care under OHIP. We need to offer services, psychotherapists, psychologists, social workers, other regulated professions, ensure core mental health and addiction services are available all regions across Ontario so people can access it where they live. And a 3-digit 24/7 crisis line.
And Liberal Party, you are up.
I strongly support safe consumption and treatment services and a CTS site in Cambridge. I condemn the public misinformation campaign by our sitting MPP. This is not a political issue, but a healthcare issue. The rhetoric was so damaging, Cambridge Memorial Hospital had to put out a statement to this effect, stating that it is a matter of life and death for so many in our community. Deaths related to opioid use and addiction have seen a staggering rise, devastating families and communities. We need to build a compassionate, non-judgmental, and supportive Cambridge and not Dumfries that aims to help those with addictions and help reduce harm. Consumption and treatment sites are proven to work, both in saving lives and addressing many community concerns that come with substance abuse. In short, I'm 100% supportive our Liberal government is very supportive of this, and there should be no concern in terms of anything but continuing the timely opening and sustainability of a CTS site in Cambridge. Thank you.
Thank you very much, everybody. Question 6. The current shelter allowance for a single person on ODSP is $497 a month. And for those on Ontario Works, it is $390 a month. The average rent for a 1-bedroom in Cambridge is $1,462 a month. And many know that that price is hard to find. Meanwhile, the average cost of a detached home in the region is now over $1 million. Our question is, what is your party's plan to invest in safe and affordable housing? And what about supportive housing? Green Party you are up first.
Thank you. So the Green Party platform is threefold. It's been called a masterclass in housing. We have a threefold. First, we look immediately at the housing crisis, and we're also looking at the bigger picture in terms of building strong neighborhoods. And we're looking at the importance and the cost effective for having a big picture of transit involved. And all these things work together because we have to create communities differently. But immediately we have to we want to build 182,000 new permanently affordable community housing rental homes over the next decade, including 60,000 permanent supportive homes. We want to mandate inclusionary zoning and require 20% affordable units in all housing projects above a certain size. We need seed funding for cooperative housing. We need to renew 260,000 community housing rental homes over the next decade. We have to do it in partnership with the federal government and the National Housing Strategy. We have to provide nonprofit housing providers with the support and the access to capital to purchase rental buildings and maintain affordability. We have to partner with nonprofits. The list goes on and on and on. Thank you.
Thank you very much. Liberal Party, you are up next.
I worry about this crisis every day. Cambridge cannot afford average house prices of $1 million. We have seen the waiting list for affordable housing in this region rise to 6,000 and homelessness increase by 34% in the last 2 years. In fact, right after this Ford government took office, they cut the planned 3% increase to welfare down to 1.5%. This government has done nothing to help people who need it most. A Liberal government will will build 130,000 deeply affordable homes, including 78,000 new community homes and 38,000 in supportive housing. We will provide municipal and nonprofit partners with $360 million annually to operate and improve social, supportive, and community housing services. Thank you.
Thank you very much. And we will move to the New Democratic Party.
Thank you. Housing is so incredibly important. Homelessness, as I have always said repeatedly, is a gateway drug. It is a gateway to despair. It is a gateway to addictions. It is a gateway to a horrible life. Where there is homelessness, there are problems. The Ontario NDP is committed to getting back into the business of building homes. We want to look into zonings, more inclusionary zonings. We want to look at townhouses, apartment buildings, co-ops, row houses. We want to look at integration and partnerships with organizations that are already in the business of building middle to low income housing, supportive housing, accessible housing, and co-ops. We will build 1.5 million homes in the next 10 years, and we will be building accessible and supportive housing because there is a dearth of that in our area. We will partner with all levels of government because this is important.
Thank you very much. The childcare deal reached between Ontario and the federal government was historic. However, as YWCA Cambridge and advocates across the province have laid out clearly, the deal does nothing to address the current and worsening labor force crisis. The $18 an hour wage floor will not address retention issues or attract new staff, nor does it provide for professional wages, such work deserves. In addition to this, the deal as it currently stands does not account for how the 86,000 proposed new childcare spaces will actually be built. Childcare Now has pointed out that it costs about $50,000 to construct one new quality space. This not including the cost of land or the purchase of property. If these significant flaws in the deal are not corrected, it's hard to believe Ontario will successfully develop a universal, affordable, and accessible childcare system that benefits all families with children. What will your government do to ensure the success of the National Childcare Plan in Ontario? And Ontario Liberal Party, we're going to look to you first.
So our Liberal platform believes in economic dignity for all. We will repeal Bill 124 immediately, treating all our frontline workers with dignity and respect that for all they do. We will create 30,000 new jobs for early childhood educators and other childcare staff to build capacity in workplaces, including schools and community spaces where they are needed the most. We will ensure we have enough ECEs who are well equipped to help kids flourish by providing free tuition for all ECE programs at Ontario colleges to make it easier for people to enter this workforce. Not only this, we anticipate at least 100,000 new childcare spaces will be needed for $10 a day childcare. Not all of these will require capital construction, as some expansion will be in existing underused space as well as homes, but many will need to be in schools and community spaces. We plan to leverage the federal investment in childcare as well as our commitment
Your time is up.
And reinvest the $10 billion in savings into our publicly funded schools to provide new childcare spaces. Thank you.
Thank you. NDP, you are up.
Thank you. We will immediately increase the standard wage for registered early childhood educators, $25 an hour and $20 per hour for all other program staff. We'll work to bring a workforce strategy to make jobs in childcare good careers. This will involve developing and implementing a wage grid and decent work standards, including benefits, a pension, daily on-site paid planning, paid professional development, and a strategy to help childcare workers upgrade their qualifications. The thing we need to agree on is that every childcare does not need to be built from the ground up. We have many empty properties and businesses that could partner with daycare staff to provide on-site daycare. And we also, of course, have home daycares. We can increase the base funding for licensed home-based childcare and provide stable funding to home-based childcare agencies so they can offer more support and training. So we'll work with all levels of government to build and provide the number of spaces needed.
Thank you. All right, Carla Johnson of the Green Party, you are up.
Just like Marjorie and Surekha said, the Green Party of Ontario is dedicated 100% to ensuring that funding continues for universal access to high quality $10 a day childcare in our communities. There are a number of creative ways to build it in the communities. There are a number of opportunities for us to do it without having to do brand new construction. And so there are many public buildings and spaces that exist already. We are going to have to get a little bit creative to do this, but it's important because it's important to give women an opportunity to re-enter the workforce. It's important to support women because it's primarily women that are carrying the burden. We've seen this through COVID. We need to support women entering and re-entering the workforce. We need to provide our early child care educators. More than 95% of them are women with at least a $25 per hour wage. We need to immediately revoke Bill 124, as we've said. And we need to know child care services in local community spaces. We need to provide child care for children with disabilities, and we need to address the social and financial barriers that exist for many families to get child care.
All right, I will stop you there. All right, I have one final question before we move on. So the Ministry of Education funding for Ontario's 72 school boards fell by an average of $800 per student from 2017-2018 to 2021-2022. The new analysis from the Canadian Centre for Policy Alternatives shows. Many parents are worried about the learning gap that many children have fallen into during the pandemic and repeated shutdowns, along with a growing child and youth mental health crisis. What are your party's priorities for education, and how and where will you invest? Marjorie Knight, we will go to the NDP first.
It's a travesty, the underfunding that has gone on in our schools. And let us not forget that in Indigenous schools, it's even less. So what are we going to do? We're going to lower class sizes right away. We're going to have to hire teachers and education workers so that we can provide the kind of education we want our children to have. We're also finally going to address some of the repairs that the schools need to make it safer for the children to go to school. We are also going to have in-school support for mental health for the children. We're going to bring in more mental health workers and child and youth workers and other education workers who can help with children's mental health. We're actually going to need to create a new position in the school board who can assess and improve and make sure that the delivery is on point for mental health in the schools. It's not enough for us to say that we are looking after it, we actually have to do it.
Thank you, Marjorie. And we will go to Carla Johnson of the Green Party for our next answer.
Thank you. A longtime teacher, I've watched the cutback since the Harris days, just one after another, and constantly downloading onto teachers who are, and hearing over and over again from the general public that we as teachers are underworked and overpaid, and there's just so much. It's been so hard on teachers, and COVID has just made it even worse. One thing I like about the Green Party platform is we want to eliminate EQAO. It is very expensive and long-term has no positive benefits for students. We're looking to make funding available for zero-emission electric school buses, and we need ventilation improvements in our schools. We need to make sure that our schools are accessible and comply with the Accessibility for Ontarians Disability Act. We have a repair backlog to deal with, We need to look at the needs that are very unique for remote and rural schools. And we need to make sure we have ESL grants in place, special ed, counselors, so many supports. We need an updated funding. Everything needs to be done so we don't turn our schools over to privatization for profit. Thank you.
And we will move on to Surekha Shenoy of the Liberal Party.
Students across the province have been dealt an unfair deal over the past 2 years. Remote learning and struggles with isolation are familiar to every family. Unlike the Ford Conservatives who cut the education budget by 1.3 billion, our Liberal government will cancel Highway 413 and redirect $10 billion to our starved education system. We will renovate and upgrade schools in our province besides capping class sizes at 20 students for all grades, hire 10,000 more teachers, hire 5,000 more special education workers, hire 1,000 more mental health workers for students and staff, put schools and community hubs in the same building, reinstate an optional grade 13, and lastly, we will end a Ford Conservatives mandatory online learning. Thank you.
Thank you, everybody, for all of your responses. We're going to move into our second portion now, which is the open Q&A portion, and that will be moderated by Dr. Sharon Ball. So I'm going to turn it over to Dr. Ball for some more questions.
Thank you so much, Tara. And thank you to the candidates for your answers. We have had additional questions come in, which I will pose to you. One quick comment, please ensure that you are on mute when not answering a question, just to eliminate background noise. So I will start with this question. The Waterloo Region Child and Youth Planning Table's recent Youth Impact Survey showed that youth in Cambridge are reporting the lowest levels of well-being, mental and physical health, support from family and friends, and sense of belonging, while they report housing insecurity to be highest in the region. Why do you think this is the case in Cambridge? What ideas or policies would you pursue? And what programs and supports do you believe we need to invest in to support our youth? I'll start with our Liberal candidate.
So youth in Ontario thrive on their relationship with families, friends, and opportunities to be active, get out in the natural world, and grow in communities where we have sports and programs as well as the daily involvement in school. We, as a Liberal government, have indicated we will get students moving 3 times more in a day to improve active living. Food insecurity is a growing crisis, and a Liberal government will introduce a daily breakfast program for all students who need it. We will encourage partnership with our community hubs on programs, hire 1,000 more mental health professionals in schools to help students, and introduce an optional grade 13 to allow students to catch up. We will also provide access to courses pursuing entrepreneurship, financial literacy, etc., to prepare them to graduate as they graduate from high school. Some of these things will help our students kind of alleviate or reduce the anxiety they have been feeling in the last 2 years. Thank you.
Same question for our NDP candidate.
Thank you. As I work in the community, I really see that problem. Even today, I was on the doors and I was speaking to a father who was concerned about his children. He had one that was obviously incredibly gifted in schoolwork, but was still struggling. And a youngster who had not progressed in 2 years because online schooling was not for him. There are a lot of problems out there, and a lot of it has to do with mental health. What are we doing? Our community centers are trying to stand up and step up and help and do programs, but their funding has been cut in so many ways that the important programs that the kids need to be able to express themselves and learn things and enjoy and live in community with their friends are gone. We need to put the money back in that. We need to get it done. We need to give kids hope again, hope that they can have fun in school and learn, and hope that they have a future to get to.
Thank you. And now to our Green Party candidate.
I remember when that information, when that study was reported, and it really, I really struggled with that because I've worked with so many young people in Cambridge, and over the years, I've seen how wonderful, creative, inventive young people are. I mean, I've learned more from them than they ever learned from me, but at the same time, I know this is real. I've seen it so often. I've seen it with my friends and people close to me. So number one, we have to stop blaming the victim. This is not the kid's fault and it's not the parents' fault. There's a bigger picture here. I recently had a young person say to me, why would I want to be here? The future for my generation is bleak. I mean, the environment is falling apart. We have the economy's in terrible shape. Things are, we have world wars going on that might spark bigger wars. And they're too smart to pretend that climate change isn't real. So what they want to see is adults actively intervening and doing something to help. And I echo everything that Marjorie and Surekha have said, goes along with our Green Party's mental health standalone platform. We need to see also communities that have a sense of belonging. The Green Party wants to create communities that you have live, work, and play with in a short distance, and you can have a sense of belonging. Thank you.
Thank you so much. The next question. At a local level, there has been a growing focus on racism, homophobia, Islamophobia, and other experiences of racism and inequity. What is your plan to address these issues within the education system? Same theme. I'll go to our NDP candidate first.
Thank you. I think that the racialized community, and rightly so, have complained for many years about the unfair targeting of their people. You know, we can talk about carding, we can talk about surveillance, we can talk about many things. But every time something goes wrong, our answer has been to give more money to the police. And I, as a community worker, see the chief of police gets a raise. And the raise that he got was more than I make in a year. We need to start taking back some of that money. We need to start putting it back into the community programs, the poverty alleviation programs, the things that address the root causes of these things. We need to spend money on education, on getting together and making people spend time together, learn about each other, to deal with the hate, to deal with those kinds of racism issues.
Thank you. To our Green Party candidate next for your reply.
Thank you. I want to give a special shout out to the teachers out there because we're talking specifically about education, I believe the question was. And I can tell you, teachers have been carrying personally the weight and the work of anti-racism initiatives in school for years and years and years. With very few resources, teachers just have to dig around and find things and come up with things. And they've been doing it from their heart and from their soul. So it's about time that the Ministry of Education took on this role, providing proper supports, curriculum, and resources for teachers in the school. And that's a huge part of the Green Party of Ontario plan. We need to make sure that they're all done though in full consultation with all the racialized groups and all the other groups in need that are that are facing inequity groups, that they need to be a voice and not just a small body. It needs to be a huge community involvement. The other thing is teachers need training because there's language changing and there's ideas changing and people need to be kept up to date. So the Green Party is looking at this in terms of a long-term vision of how we do this and advocate for everyone in our schools. Thank you.
Thank you. And to our Liberal Party candidate.
Personally, our strength is diversity, and everyone should feel safe and inclusive wherever they choose to live without fear, regardless of their sexual orientation, their skin color, or the religion they choose to follow. As a woman of color, I agree we need to address the growing divide. I believe education is the best way to remove ignorance and biases. We will enhance the curriculum to educate from day one when they enter school. I firmly believe we need to work together to remove systemic racism and have more uncomfortable conversations. A Liberal government will make critical investments to update our curriculum to reflect a more modern and diverse Ontario. We absolutely need to have more respectful and open dialogue. Thank you.
Thank you so much. 1.3 million Ontarians are living without a family physician. The Ontario College of Family Physicians, the OCFP, is highlighting this lack of access to primary care in its Life Without a Doctor campaign. How would you address this growing problem in attracting medical students to family medicine residency spots, in retaining burnt out family physicians to stay in practice, and to actually keep them in the province? That's the question. I'll start with our Green Party candidate first.
People stay where they feel valued and supported. It's as simple as that, where they know they're needed and where people are relying on them. And a big part of the Green Party platform is creating these caring communities that are connected to each other. So we need to have communities instead of just allowing for random sprawl. And this is, again, the Green Party has a bigger picture in mind, not just an immediate tweak of the system, but something bigger, create communities that are where we can live, work, and play within 15 minutes of each other. So if we have nurses and our doctors and our facilities right nearby, we're all relying on each other. We also have a huge backlog of people that have international qualifications, born here, in fact, with international qualifications that we need to spearhead and bring into the practice and bring them into our province and get them active. There's a lot of, I think, strange and unusual obstacles for people who have international qualifications to try and get into the various professions. And the big thing is pay them properly. Make sure they are paid properly and respected properly. Thank you.
Thank you. Next to our Liberal Party candidate.
So the first thing to do is address the shortage in doctors and nurses that we have. There are many ways. First of all, internationally trained doctors. I know so many who are unable to get accreditation or get qualified to enter the workforce. We could easily access them to reduce the shortage of doctors that we face today in our communities. That is one thing. We have promised we would hire 100,000 new nurses and doctors and other healthcare workers to immediately help the growing shortage that our communities face. We want to introduce 20 more community related healthcare facilities so that it can provide people easy access to healthcare when they need it. We also have said we will give more access to people to a doctor or a nurse practitioner within 24 hours of when they need help. So these are some of the things we are trying to do to address the shortage.
Thank you. And next to our NDP candidate.
I remember moving into this community with my family and not being able to find a doctor. For someone like me who must have health care, it was a crisis. And it took me a long time to find a doctor. We have to find ways of linking people to doctors. I know that we have a website, but we need to do more than just have a website. We need to retain the doctors that we have here now. We need to keep them, and we are losing them. We need to meet with them. We need to talk with them. We need to come up with a plan. We need our doctors. The other thing is that internationally trained doctors should absolutely have a clear path to accreditation. I will tell you, my sister came to Canada to sick kids as a resident to do her rotation. They wanted her to stay. And they said, well, if you want to stay, you have to go for a year in Nunavut. Jamaicans and Nunavut would not work. We must do better in how we can retain doctors here.
Thank you. This next question comes to us from our friends at Shore Center and originally appeared in the Feminist Shift All Candidates Survey. Access to reproductive health care, including abortion care and birth control, remains riddled with barriers in Ontario. Community members are often forced to travel out of town, take additional time off work, incur significant personal costs, and or choose between their care and paying their bills. How will your government ensure access to reproductive health care for all Ontarians, and will you commit to universal birth control coverage in Ontario? I'll start with our Liberal candidate first.
A Liberal government will absolutely ensure that women across the province have equal opportunities, including equal pay and expanded access to healthcare. Women should not have to fight with their own government on reproductive rights. Ontario Liberal government will respect a woman's right to choose and expand access to women's health. We are committed to funding all women's health needs, including postpartum mental health abortion, and reproductive services. We will expand the Ontario Fertility Program to cover one cycle of egg freezing and provide free menstrual products in public spaces like schools and libraries. We will create an Ontario women's health strategy to ensure a Liberal government's decisions on women's health are progressive and evidence-based. Thank you.
Thank you. And next to our NDP candidate, please.
Thank you. The Ontario NDP believes in respecting people's right to make decisions about their own bodies and their own lives. Everyone deserves safe, accessible abortion and reproductive health care services, no matter who they are or where they live. It's not enough for elected officials to say that they won't reopen the abortion debate. We need leaders to take action to improve access to services. Abortion is health care, and we all have a right to decide for ourselves. We're committed to making investments in critical services to ensure everyone in Ontario has access to reproductive health care, and we will make contraception free. I cannot tell you how much I stand behind this, because never again in my lifetime do I ever want to see a pregnant 10-year-old child, as I have seen in my work. Never again. We must have free access. Thank you.
Thank you. And next to our Green Party candidate.
This is a really big deal. I am deeply, deeply bothered by people who keep bringing up this conversation, people who are standing saying they're anti-choice and making that the point to get votes. People who will use this as a play to get votes, I have zero respect for, because this is body autonomy is such an important thing, and the Green Party is 100% supporting body autonomy for everyone. The Green Party wants to build a more equitable healthcare system, so that means fully respecting everyone's say over their own bodies. We want to expand the number of and fully fund women, and I would add trans men health clinics across Ontario and abortion clinics all across Ontario, because we need to have more equal access no matter where you live. That creates a more equitable healthcare system. And we have a lot of policies that need to address adverse effects of things like racism and homophobia, transphobia, mental health issues. These are all woven in. Thank you.
Thank you. Our next question comes from a local long-term care administrator. Several of our long-term care homes have been awarded beds, which are very much needed in this community. However, escalating construction costs and increased interest rates are causing operators to pause and reconsider whether or not building will be possible. What type of investment are you prepared to make to ensure these projects move forward? I'll start with our NDP candidate first, please.
There is no doubt that we do need beds, but even more than beds, we need staff. Do we have the staff to fund this? Because I'm telling you, a bed without staff is just a mattress on the floor. Someone said that to me, and I agree 100% with that. We are absolutely committed to building and to having more LTC beds. Maybe not by adding on to existing large warehouse type of LTC, but maybe smaller, more culturally competent, smaller, home-like LTC beds. In either case, we will be investing heavily to make sure that our seniors who have paid their dues and built our community have safe places to live. Thank you.
Thank you. And to our Green Party candidate next.
The Green Party has a goal of creating caring society, connected communities with a new climate economy. And this ties completely into caring society and connected communities. There need to be a lot of options. Things need to move forward. We do have obstacles. There are going to be challenges. There's no denying. I'm not going to paint anything pie in the sky about it, but we need to have a lot of options where people can get care in their homes, because that's fundamentally less expensive than putting people into buildings too. And the Green Party has a policy of looking at in-home care and in-home care for long-term care and for needs as much as possible. So there are many, many opportunities and options that exist there, and we have to all work together to come with our best options as possible. Thank you.
Thank you. And to our Liberal Party candidate.
So one of the things we noticed during the pandemic was the horrific tragedies in the long-term care facilities. The Ontario Liberal government has said we would transform long-term elder care by stopping for-profit long-term care facilities. This is one of the most transformational, bold ideas that the Liberal government has said we will do. And rather than warehouse our seniors, we said we would introduce community or small home-based elder care. One of the things we said we would do is increase home care by making sure that we introduce 4 hours of home care to seniors who want to stay at home. My own father had to go into a long-term care facility only because they wouldn't give me 1 additional hour of home care. And seniors want to age at home with dignity. We are also going to make sure that we will provide seniors with all the facilities they need by having accessories at home. Thank you. Anyway, we'll continue. You can go to our website.
Okay, thank you. One of there have been some questions on, of course, housing affordability. And so just to follow up on the previous one from Tara's, because it is something that's coming in a fair bit. One of the biggest groups that has been left behind by housing policy over the last 10 years is renters. With the cost of living rising and loopholes that allow renters to raise rents whenever to whatever the market rate is after each tenancy, renters are feeling the squeeze. And many are finding themselves priced out of the rental market. What will your party specifically do to support renters? And how do you propose we change the Ontario housing system to work better for everyone? So that question will start with our Liberal candidate, please.
So renters' lives are getting less affordable and less predictable every year. The Ontario Liberals have a plan to make buying and renting affordable by building urgently needed homes, putting land speculators on notice, and closing the rent control loopholes. We will bring back rent control to all homes across Ontario and ensure all renters have smaller, more predictable rent increases. We will also provide renters with a path to ownership and create a legal framework that protects renters to opt into rent-to-own agreements. And we will double the pace of home building to help both renters and first-time home buyers by introducing the Ontario Home Building Corporation. Thank you.
Thank you. And next to our NDP candidate.
Thank you. The Ontario NDP has not forgotten the needs of renters. We are going to be helping the most vulnerable 311,000 households pay the rent with direct financial support. We're going to bring back rent control, and we're going to end vacancy decontrol, which is the rising of rent in between tenants. We are also going to put an end to this renoviction thing. It's just wrong. And renters should not face unfair rent hikes or eviction as a result of renovations. We're also going to be looking into vacancies and how vacant houses are sitting there gaining money for their owners and not being rented. We're going to help them along with a little tax to get us some more money for rental housing. And of course, speculation. We're going to have to be dealing with that. And perhaps a tax will come there too.
Thank you. And next to our Green Party candidate.
Yeah, I will echo what both my NDP and Liberal cohorts have said here today. We saw this firsthand in my campaign team. I had one of my campaign team members had to move 3 times in less than 12 months this year. And every time the rent went up, and it's a whole long story, it was covered in Cambridge Today and got really excellent coverage on her situation. 3 times the rent went up significantly with each room, with each move, and it was complicated by the fact that this person has accessibility needs, which made it even harder. So we have a lot of things to address in terms of our rental portfolio in Ontario. And I echo what my cohorts have said here. One of the things what's happening is people are being driven from urban centers. They're going out into the rural areas, which is now creating longer commutes, which is a problem. It's a problem environmentally, and it's a problem for mental health. So we want to look at, one of the things we want to look at is increased funding for the landlord-tenant board, so issues can be dealt with quicker and faster, and reduce delays so people can talk, work things out. Okay, thank you.
Great. Our environment and the health of our climate is part of a healthy society and is a key to a safe, secure future for our children. Each of your parties has different thoughts on how to approach green energy and solve the problems around climate change. Can you share your party's view on this topic? And I'm going to start with our Green Party candidate, please. And you're on mute, Carla.
Thank you. Would you mind just repeating the question one more time?
Yes, I'm happy to. The question's around climate change and the policies of your parties. So basically, our environment and the health of it are part of a healthy society, a key to a safe, secure future for our children. And each of your parties has different thoughts and policies on how to approach green energy and how to deal with climate change. So can you please comment?
Happy to. This is one of the things that gets me excited with the Green Party, because the Green Party is talking very much about the green economy, and the green economy is nothing but opportunity. There's so many opportunities with the new green economy. There's opportunities for small businesses and large businesses. There's opportunity for entrepreneurs. This is a hopeful future. This is what young people want to see. As a teacher, I know young people want to see things being done differently. There have been, right now, there's a big push to get a big highway through the Marshlands Highway 413. And that's kind of backward thinking that young people today really, really struggle with, because they want to be a part of something new and they want to be moving forward, not doing things the old way. So in terms of renewable energy, reducing greenhouse gases, there's so many opportunities ahead that people should be excited to jump in and get involved with doing. I am a Green Party member who drives an SUV, and I cannot wait to be able to afford an electrical SUV. And I'm waiting, and everyone's waiting for those incentives to come back, because that's what we need to help people get new vehicles and get going.
Thank you. And to our Liberal Party candidate next.
So tackling the climate emergency is important to us, and building an economy that pollutes less while creating more jobs is the platform we are running on. Our Liberal government will cut Ontario's carbon pollution in half by 2030. We will create 25,000 more green jobs and train people for them. We will charge carbon polluters and reward companies who lower their emissions. We will ban new natural gas plants and transition to a fully green energy supply. We will protect our land and increase protected land by 30% and protect our green belt. We will create 5 additional provincial parks. We want to encourage people to move on to transit, and we have introduced Bucka Ride, which will help get people onto buses than driving on the roads. We will also plant 800 million trees over 10 years to help reduce our carbon footprint. And so these are some of the things we are planning to do. And I know we will help achieve our Paris Accord standards of reducing carbon emissions.
And next to our NDP candidate.
So we're aiming for net zero on carbon emissions no later than 2050, which is in line with the Paris Accord. But how do we do this? And how do we, the normal people from day to day, do this? Well, there are a few things we can do. We're going to move and invest in green electric vehicle strategies. We're going to electrify our transportation system so that people can get out of their cars and go by bus, which is electric, which will be wonderful. We are going to offer incentives so that people can buy electric cars. We're going to create business and jobs. We're going to retool our manufacturing places that we lost business from, because now we can get into the green business of making batteries and other kinds of accessories that will be needed for a green economy. We will retrofit homes and businesses. And in doing this, we will have jobs for people to work. We are going to lead the way in a green economy with jobs that bring everybody along.
Thank you. And I do believe we have time for one more question that's come in. In this person's view, our community has suffered significantly in the last 2 years because our political representatives have not done a good job of advocating for Cambridge. And many organizations have struggled to get support from our MPP throughout the pandemic. So this person is asking, what would you say to the two candidates who are not here tonight? And how are you planning to rebuild these relationships? So I think I will go first to the NDP candidate for your response to that community member.
I'm a family outreach worker. That means that I work with every level of government. That means in order to help my people, I have to reach out. I have to give phone calls. I have to ask for help, help that can only come from an elected official. I am sad to say that I have not been able to get any help from any conservative elected official when I have needed help. I can say that I've reached out to other parties who are in power and they have helped me. It is not about me and it's not about them. It is about public service. That is what we're supposed to be doing. And I insist that when someone is elected, that they are there to serve the public, whomever they may be. You are now there to serve everybody. And until we get this straight, we're going to continue having these problems.
Thank you. Same question next to our Green Party candidate.
I can assure you, you are looking at 3 candidates here that are all heavily involved in the community, very concerned about cutbacks that are affecting our most vulnerable. We are all 3 of us, and I'm going to speak on behalf of all 3 of us and tell you that we are all 3 of us heavily involved, wanting to make this community a better place to live without a question. I am deeply bothered by the fact that these candidates are not here today to be accountable and not here to listen. Every day we get petitions, requests. I spent hours preparing the questions for tonight because I want you to understand how much I care about the community, want to be here. And I know the candidates with me tonight also. And yet we have candidates who didn't even bother to come or were unable to attend. And this bothers me on such a fundamental level. Public servants are supposed to be servants and they're supposed to care. And I can assure you that the 3 of us sitting here deeply, deeply care and are very bothered by the cuts in our community and the neglect.
Thank you. And the same question to our Liberal candidate, please.
So I'll say my 2 colleagues were nice by saying unable to attend. I was a past candidate in the last 2018 election, and this is a regular behavior with our conservative colleagues. They never show up. They know for sure people will elect them, and that is what happened. They got a mandate last time without a platform, and they continue to show this behavior. It is absolutely wrong to have people say they are they want to be public servants and not attend these meetings to answer questions from the public. I have knocked on over close to 10,000 doors now, and I get only one answer every time I go to the doors. First, they're pleased that I came to the door. Second, they say no one has ever come to our doors in the years that we have lived here. That is pathetic in terms of no wonder people are not engaged. People are not engaged because nobody cares about them. If you want to be a public servant, you should absolutely be available to the communities, especially during that election time, to answer questions. And I don't think these 2 candidates deserve your vote, and you should not be voting for them. Thank you.
Hey folks, can you hear me? I'm not sure if we lost Sharon or Tara.
I was just coming on to say I think we lost Sharon.
Yeah.
Well, do we?
Yeah, I'm gonna pass it over to you, Tara.
Okay. All right, so we would like to thank everybody for attending this evening. Thank you for all of your answers. I want to give an opportunity for closing remarks. If anybody, or did we just do the closing remarks? I'm sorry, I feel like I might have missed something.
No, it's all good, Tara. Yeah, we just put you on the spot. Let's start with closing remarks, and I'm just picking at random. And who's first on my screen? Carla from the Green Party. Let's have your 30 seconds of closing remarks, please.
30 seconds, here we go. The Cambridge riding is made up of several smaller communities: Ayr, Blair, Clyde, Glen Morris, Roseville, Preston, and Galt. Together, we have the amenities of a large city with the community spirit of smaller living. It is a beautiful place. Many know me as their teacher or their child's teacher, and I've loved working with so many in the community. Students from all walks of life have come and gone through my classroom. I often say I've learned more from them than they from me. I've done a lot of volunteering in the community, but to me, the larger Cambridge riding is simply an extension of my classroom. Students come to me with strengths and needs, and my job as an MP would be to serve the community, to advocate for the needs, and to build on the strengths, all the while having a little fun along the way. There is reason to hope we can create a province we're proud to call home, a province that values its natural resources and embraces each person, no one left out. If you have any questions, please reach out, www.carlajohnson.ca. Thank you.
Thanks, Carla. I didn't actually time that, folks. I'm not the timer here. So this is ending on a great note, but I see Sharon's back. So Sharon, I just had Carla give her closing remarks. I'm going to pass it on to you to select the next candidate who will give their closing remarks.
Thank you so much. My apologies, connection issues there. Let's go to our NDP candidate, Marjorie, next.
We have heard in this debate about the different plans for how our community is going to be represented at Queen's Park. Elections are about choices, and far too long we've had politicians with different priorities that have put their interests before ours, and Cambridge deserves better. You deserve an MPP who knows and cares about this community, who will always work with the community to fix things that matter most. I'm running to be your MPP, to be a voice for action, bringing change and an optimism for the future that invites everyone to sit at the table. Thank you.
Thank you. And next to Surekha.
Ontario can be a place to grow, but only if we make the right choices. We need to rebuild what has made Ontario strong: our education, healthcare, public services that support working families. These are all key to a better future and economic dignity for our families. This election is about choices. It is about affordability. It's about healthcare. It is about building an environment or a planet that is sustainable for our younger generations. We can continue to politicize climate crisis, or we can take action now to keep Ontario beautiful for future generations. Cambridge can be a place to grow, but only if you make the right choices on June 2nd. And I hope that choice is yours. I know that, and I hope it is me. Thank you for listening, and thank you for the opportunity.
Thank you so much. Thank you to all of you for being here. Thank you to our organizers, again, the Cambridge Shelter Corporation, the Cambridge Foodbank, YWCA Cambridge, Family Counselling Cambridge, Centre of Cambridge North Dumfries, and the Cambridge North Dumfries Ontario Health Team. And thank you to the viewers. Hopefully this was helpful for you in helping you to make your decision today. I hope everyone has a good evening, and you've given us lots to think about. Have a nice night.
Thank you.